One more test which I have missed here is stress testing. That is, we have to do a treadmill test. Most of you know, are aware of this test. That is a treadmill test. It is mainly done to measure blood pressure and heart rate. So that is one, or that is also one of the thing which we can do to diagnose the condition, uh, VHD. Coming to the management, so in the previous slides I have mentioned how to manage individually, to about the types of valvular heart disease. So this is the management for, it is commonly for all the types of valvular heart diseases. First one is, main important thing is lifestyle modification. So if the patient is or individual is smoker, smoking cessation should be done. Follow prevention tips for heart healthy lifestyle. So follow a lifestyle which is healthy for heart, and avoid excess alcohol consumption and excessive salt intake and diet pills. So those who are taking salt intake excessively, or that can lead to hypertension also. Because of that hypertension, it can lead to valvular heart disease. And diet pills, so those who are under pills for diet and all, so that is also in an excessive condition, that is also harmful. And course of antibiotics is prescribed prior to surgery or dental for those with VHD to prevent bacterial endocarditis. So bacterial endocarditis is also one of the causes of VHD. So for those who are having, or for those to prevent the bacterial endocarditis in an individual, course of antibiotics are prescribed. Long-term antibiotic therapy is also recommended to the patient, those who had a previous history of rheumatic fever. So rheumatic fever is one of the causes of VHD, and rheumatic heart disease also. And because of rheumatic heart disease also, it can lead to vascular disease. So there is this is all caused due to a bacterial infection called as group A beta hemolytic streptococcal bacteria. So because of that, the individual may get a rheumatic fever. So if an individual having a history of rheumatic fever, an antibiotic therapy for a long term is recommended. Antithrombotic, that is clot preventing medication such as aspirin, may be prescribed for those with VHD and who have experienced unexplained transient ischemic attack. So whoever have an experience episodes of ischemic attack, so for them antithrombotic medications can be prescribed. And anticoagulant, so blood thinners such as warfarin also can be prescribed in case of in this for managing VHD for the patient. Coming to the surgical management, the main two surgical procedure we are doing in this case is balloon dilatation and valve surgery, that is valve repair or valve replacement. So replacement valves can be artificial also, that is a prosthetic valve. And in case of prosthetic valve, it require a lifelong anticoagulants, but these last long. So those who are having got a surgery which is with a prosthetic valve, that replacement valves with artificial prosthetic valve, so these patients have to take anticoagulants tablets for a lifelong. And this prosthetic valve is good, better than the animal tissue, that is bioprosthetic valves. This will last longer. So those from animal tissue, that is bioprosthetic valve, it does not require any anticoagulants, but it will not last longer, it will be lasting for a shorter time. So these are the two surgical procedures we are doing to manage the VHD condition. Prevention. So the chances of VHD can be lowered through following these below mentioned things. So first one is treatment for a sore throat that lasts longer than 48 hours. So if a patient is having a sore throat which is lasting longer for a 48 hours, with especially if it is accompanied with fever, timely administration of antibiotics may prevent the development of rheumatic fever which can cause VHD. So as I have mentioned before, rheumatic fever is also one of the causes of VHD. So we can prevent the rheumatic fever by giving a proper treatment if the patient have a sore throat. And a healthy lifestyle modification to reduce the risk of hypertension, atherosclerosis, and heart attack. Avoid smoking, alcohol consumption, and eating a balanced diet, regular exercise of overweight, and maintaining blood sugar levels in diabetics. And if the patient is obese, or if he's having an increased BMI range, then he have to follow a proper lifestyle and a healthy diet and regular exercise to maintain his weight and a balanced life. And avoid, if the patient is a smoker, or a daily smoker, or or he's having taking alcohol on a daily basis, so make sure that you avoid the smoking and alcohol consumption, and maintain blood sugar levels. So if a patient is diabetic and he is not maintaining his blood sugar level, so that is also one of the problem in this case. So you have to maintain your blood sugar level, check every time, and take the tablets. So those who are under medication for not only for diabetics, even for hypertension also, make sure you manage the sugar level and the hypertension. So make sure you check every month or alternative months about your medicines and about your health. So this comes to